The concept of a bone fusion surgery with a screw fixation is to completely fix the spine when it is unstable and stabilize it so that it does not move. With it, the area causing pain is completely fixed and resolved, but other issues may arise. Especially for elderly patients or those with severe osteoporosis, various problems may arise even after the surgery, such as the fixed device digging into the bone or the screw falling out. Also, the disc in the adjacent area may degenerate more quickly. So, in order to compensate for these things, you can think of soft stabilization as a concept between two existing decompression procedure and bone fusion with screw fixation. The biggest difference is that fixation surgery is a method to completely remove the damaged disc and fix it when the disc joint fully wears out. However, soft stabilization is performed when the spinal disc is still usable. It preserves the disc in front rather than cut it out. The concept of soft stabilization is to cut off the thickened ligaments or other thickened joints in the back to prevent compressing the nerves, and then tie the bones in the back so that they function as the ligaments. Unlike existing bone fusion with screw fixation, it is not completely fixed, so the stress on the disc in the adjacent area is definitely reduced. Compared to screw fixation surgery, it is less burdensome for people with weaker bones or elderly patients. For soft stabilization, we have a specially manufactured artificial ligament. The surgery is performed by hanging this ligament between the bones in the back like this. About 2 to 3 months after the surgery, the tissues inside the body are completely fixed into the small space between the artificial ligaments and it becomes solid. So it takes over the role of ligaments that used to hold the vertebrae together. The biggest advantage is that it can be treated even in elderly people. It can be a good alternative for people who have lesions in several places rather than just one, making it very difficult to undergo bone fusion surgery with screw fixation. This is because the surgery itself rarely affects the bone. There is less bleeding, and the operation time is also short. For multiple stenosis, there are many patients who are unable to receive treatment and struggle while continuing conservative treatment. For such people, this soft stabilization can be an alternative. The two processes of releasing the nerve from the back and then tying the bone with a string from the back are suitable for people who have weak bones or elderly patients. This is possible for everyone. For the patients whose instability is not very severe and have symptoms due to nerve compression in the back, rather than a neurological symptom caused by losing the disc height, it can be resolved well with soft stabilization. Of course, it cannot replace all existing bone fusion surgeries. The most important thing is how much the disc in the front of the spine has degenerated. If the disc is severely degenerated so the disc height is lost too much and if it is unstable and shakes, the shaking itself can cause a lot of pain. For this case, bone fusion with screw fixation is the appropriate method. After spine surgery, some patients often ask, why avoid exercise? After a certain period of recovery after surgery, you should exercise more actively. Because the joints that are more degenerated and surgery was performed weak areas. For sufficient fixation and support of the adjacent area, the surrounding muscles of the spine should be strengthened. It is important to do the exercise that can strengthen the spinal muscles without much pressure. Walking, swimming, indoor, biking, etc. are good exercises that don't put a burden on your back and can strengthen the muscles. As it is now becoming an aging society rapidly, the age of patients is naturally rising. Following this, the number of patients with spinal diseases is expected to increase even more than it is now. Trying to treat all patients with bone fusion with screw fixation is not even in line with a recent trend. Depending on the patient's disease, soft stabilization can be a good option rather than bone fusion surgery as the patient is less burdened and the recovery is faster. Thank you.